Good morning, good afternoon, good evening. You are tuned into the Vitamin D podcast, and I am your host, Dawn Dai, here to get you excited about your life. Now, if this is your first time, welcome. Vitamin D is all about you living life on purpose and for purpose. And guess what? It's a pun off my name. You know how you get vitamin D from the sun, right? Well, my name is Dawn, and I'm here to shed light into your life. And today, I'm shedding a light on pandemic pregnancy, women's health, and of course, we're going to talk about the vitamin D, because everybody needs that D. And so I invited a special guest of mine, the incomparable, double board certified physician in OB-GYN and maternal medicine and director of perinatal services at NYC Health Hospitals, Lincoln in the Bronx, New York. The one and only Dr. Kecia Gaither. So without further ado, ladies and gentlemen, it's time for your dose of vitamin D.
Get your vitamin D right here with me and get excited about your life.
Hello there, Dr. Kecia Gaither.
Hello, Miss Day. How are you? Hello, audience.
It's so good to see you.
Good to see you, too. I'm jealous of your weather down there in California.
You know, we have to be a full representation of vitamin D, so bringing light all the way around.
I know. You got that sunshine.
And I hope we're shedding some to your way.
Yeah, we've got some rain here. Hopefully we'll get some sun tomorrow so we can get some of that vitamin D.
So how you doing, though? How you been holding up in this pandemic?
Well, it's much better now. I can definitely say that. When we were in the height of it, it was a bit much. It really was. Very scary.
It's a change. It's something different. You know, it's a mode of where we're all going in, which is a good thing, right?
Mm-hmm.
As far as within ourselves and doing work and really evaluating. But while we're also in a emotional and a spiritual sense going in, we're physically going in. And that's why I'm so excited to have you on, because I talk about vitamin D from an inspirational and motivational level.
Okay.
But I got you on to not even sprinkle it there, but we're also going to be talking about how important it is with health and Black maternal health, because let's face it, a lot of people are inside. And while they may not have the vitamin D from outside, they're sure getting some D from somewhere.
Absolutely.
And a lot of people are having babies. And when we look at the disparity in general, when it comes down to Black women and pregnancy and death rates and health, one can only be alarmed and want to know, how does vitamin D connect? And so that's where you come in.
Okay. All right. So let's talk a little bit about vitamin D. Vitamin D is made in the skin in conjunction with sunlight. For people of color, the melanin can inhibit the normal production of vitamin D. Now, given the fact that we're in COVID and we're in the house, and there are a lot of people of color who are in the house, it is certain that there are many people who are vitamin D deficient. So given that fact, let's talk about vitamin D and what it does for a normal human as well as a pregnant human. So vitamin D is involved in a lot of things. It's involved in your cardiovascular health. It's involved in bone health. It's involved with your mentation. In pregnant women, it's certainly important to have high levels of it, such that there's normal fetal bone development. And vitamin D deficiency has been correlated with an increased risk of preterm labor. Now, given the fact that we are in COVID has a tendency to attack more readily those people that are vitamin D deficient. So for any woman out there who's pregnant of color, it is very important for you to be having a supplement. One thing that I would advise is for you to ask your doctor to check your vitamin D level. Any pregnant woman that graces my office, she's automatically getting a vitamin D level check.
Question for you. So I really like this. Let's go to a two-shot of Dr. Gaither and not Jeremiah. I really like this because one of the things that I think about as I'm in this age, in this realm of children is something that is on top of mind. Mm-hmm. And let's face it, being in LA, being a woman that is about her career and in a vision, you know, that's something that you want to ensure that everything's okay. And so I've had friends and different people that have been close to me that have been affected by fibroids. And I can't help but think about that when we're talking about being in the childbearing years, but then also understanding the vitamin D, because I understand they come one in one. And while we're talking about the disparity of how, 3 to 4 women more times likely to die than white women while being pregnant, one can only wonder what's going on here and how important that vitamin D is taking place when it comes to even the womb that is going to carry this baby.
Absolutely. So that's why I recommend that every woman who's in childbearing age or pregnant, they need to get the vitamin D level checked. You know, it's good to have a level of 40 to 80 nanograms per milliliter. Your physician can check your level, or you can get your own kit. There's a great website called powerofd.org where it has a lot of information on various vitamins. You can get your own kit. You can get involved in research concerning vitamin D. So it's a great option for you to have if you want to check your own vitamin D level. Okay.
So let's just talk a little bit about the stats and what's going on. So I understand an article that you published, right? Although the U.S. is spending $111 billion per year, okay, and this is on maternal, prenatal, and newborn care, within roughly, a 30-year time span, deaths, Black maternal deaths have increased 150%.
Yeah.
Is it just because of vitamin D? What's going on?
Well, I think it's multifactorial. Let's list some of the things. Lack of prenatal care, or if you go to prenatal care, you're going late. With comorbid conditions that have, basically expanded and caused problems. You have to contend with lack of insurance. You have to contend with a system that may not be that nice to people of color, contending with implicit bias and racism, women not being listened to, women not being offered the same treatments, procedures, etc., that are offered to other people who are not melanated. So it's a multifaceted issue.
And so while we see these issues, how do we attack them, or how do we approach them?
Well, I think it kind of starts at the top. And there have been legislators, particularly like Senator Adams, who is proposing legislation to address Black maternal mortality. Okay, and it's a 12 bulleted bill that deals with specific issues. The ability to get prenatal care, the ability to have genetic testing, attention to those women who are in prison, the ability to have expanded Medicaid, in that fourth trimester. And the fourth trimester refers to the postpartum period. So there are a whole list of things that specifically address some of the issues that are seen in elevated Black maternal mortality.
It just baffles me when you really think about it, how there's so many pressures that's coming left and right. And just in the times that we're in, and we're talking to all the racial disparities, and people can turn around and say, oh, that was yesteryears, not understanding the ripple down effect that it affects a 360 view. And it's so interesting how people can understand how a child can perhaps be traumatized in life. And let's just say, a 30-year-old in the first 5 years, be traumatized and can understand why this person is going in the direction of their life. And when you talk about certain peoples of color, those of melanin hue, we're talking hundreds and hundreds of years. So now that it isn't just a point of where we're working in society, we're talking about the genetic makeup of our existence. Mm-hmm. And I'm so glad we're having this conversation, because I was talking to a good girlfriend of mine, and I don't think people are adhering to how serious it is when you are expecting a child or trying to have a child, about the traumas that it does happen in your life. I remember when I was, my mom passed away, in 2012. But one of the things that she told me, she said, Dawn, she never said Dawn. She said, Dawn, having a baby is like going through death, because your body is going through so much of a metamorphosis. And so now we have a situation, as you're explaining, things that have been systemic, things that have been passed down in a mental place, that's taken on the physical, and how it's another slash, so to speak, to the development of people of color, their existence.
Well, what's interesting? There's a book around called Medical Apartheid by Harriet Washington. And it talks about the health care of people of color in the United States from slavery onward. What we're seeing is nothing new. I think the attention that's being put to it now is due to the fact that we have the internet, we have social media, and so people are physically seeing it. Okay, but what we're seeing is really nothing new, unfortunately so.
And I guess I appreciate you, because I think these kind of conversations need to happen. I heard a friend just shedding light just more on fertility and just what it means. I'm not sure if it's in the forefront of a lot of people of color, because oftentimes it's like, hey, you better not go out there and get pregnant. It's like a slash of no, no, no. While in other cultures, I understand that it's something that's pre-planned. There's a fund that you may put together, that you may adhere to your medical, whether it's the fund for you to freeze your eggs. Mm-hmm. So it's something that the conversation is on top of mind, and where the placement and where you are. And as I see these more conversations happening, I think of even a close family member experiencing preeclampsia, a serious moment where could have lost her life. And for some, they've never even heard about it.
Yeah, I'm a little jaded as far as individuals not knowing about certain medical conditions that are relatively common. You have to wonder what kind of conversations are being had with their healthcare providers and them, that they don't know about the most basic things that can happen during pregnancy, like preeclampsia, diabetes, and so forth and so on. So it's important to have shows like this that spread information.
Thank you, because, I think oftentimes when you're even selecting your insurance provider, to even know what exactly are you selecting and what it means. Understanding that there are books out there that explain what the code, so depending on your family, depending on your dynamic, depending on your individual needs, ensuring that the coverage is under there. do you have a recommendation as a site, or where is the first go-to to understand coverage, maybe in the OB-GYN world?
That's an interesting question. I cannot say that I have a go-to. I think that if you are looking for a particular physician of color, I think it might be prudent for you to look at various websites or organizations. There's blackdoctor.org. There is the National Medical Association that has branches in every state. Their headquarters is in Washington, and it's helpful to maybe reach out to them and see what physicians are in your area and what insurances they take.
Okay. Because I know even for myself of just looking up, sometimes it's hard and it's like, not knowing where to go. And it's good to know that you can have a site such as blackdoctor.org, that you can get people that look like you, can understand the conversation, can understand the disparities that you're experiencing.
Mm-hmm.
So along with the idea, we're talking about the lack of vitamin D and comes to fertility, we understand that there's a overarching theme as well of just women's health overall, talking about obesity and diabetes. And we know that that's something that plagues the African-American culture. Can you give us some more insight on that?
Well, here's the thing. When you look at what your grandparents and great-grandparents ate, they pretty much ate from the land. I mean, because I would say that most people in the United States, they hail from Southern roots. Now, the diet was primarily, at that time, grown from the earth. Were no additives to it. Whereas now you look at our diet, everything is packaged, processed, and filled with sugar, corn syrup. So, your diet precludes to your health. Your diet filled with sugar increases your risk for obesity. Obesity has now become a pandemic in the Black community. And as such, you see a lot of things coming out of that. You see diabetes. You see heart disease. You see high blood pressure. So now you've got a whole generation of people who have been impacted by their diet who now have these comorbidities. Wow.
And it's interesting that when you talk about how systemic racism plays a factor, there's a time when I was on public assistance. So I would have to go in the neighborhoods to go to my insurance. And if you look around at places to eat, everything is processed. Mm-hmm. And I'm talking mountains down where it's like, well, what is in that burger? So the option isn't even there. And even for myself, where I've seen a huge change in my lifestyle is that I blended in a bit of a vegan diet.
Me too.
Come on now.
Me too. I mean, there is something to be said for a vegan diet. It's certainly heart healthy. You're not being exposed to all the hormones that have been injected into meat. It's readily digest. It's helpful for the gut biome. And your gut biome has been found to be very much correlated with your health. So, I'm not a full vegan, but at least 3 to 4 days a week, I'm eating a vegetarian diet.
And it feels good. And I think also, too, it's a thing where we have to realize the balance. I briefly mentioned, I talked about the preeclampsia, but even when you're looking at obesity, to me, it's just pressure, restriction, and like a lot of the weight. And if it's a lot of the foods and the processing, it's like a moment of things need to flow through and relax. And when we're talking about, you said, hey, I'm doing it 3 to 4 times a week. I think it's that flexibility of balance. And that's what I try to talk about with vitamin D as well. I talk about how you are your greatest asset. And it's about a balance, because when you talk about your life bank account, it's about what you put in and what you take out. And let's face it, if you may not be a person that is going to be 365, 7 days a week where you're eating vegan, but it's just taking the first step and figuring out ways to balance.
I think that we as a people really need to look at what we're eating and really kind of go back to how our ancestors ate. Okay? In my family, the women live a long time, and longevity, I feel, is related to your diet. My great-grandmother lived to be 104. She lived off the earth. My grandmother, she succumbed at the age of 70 from heart disease. But then I looked at what she ate. A lot of fried foods, So you learn and you need to think about what is best and how you should move forward in life by regulating your diet.
And that's a mastery, to really have control of self. And that's why I really love the bridge and how you're coming in and you're talking about the importance of vitamin D, because it's about just shedding light on things such as this, to understand that you have to actively make a decision to love yourself and to do better. Because we can't control the cards that we are dealt in life, but you can control how you play it. So yes, you may be in a situation where readily accessible the food that you need, or perhaps you may have some pre-existing condition, but it's about the right now and what you can do from there. Because then you realize that it not only affects you, but generations to come.
It does. It does, obese moms who have diabetes, get pregnant, end up having big babies. And those babies are at an increased risk of developing diabetes in childhood, as well as into adulthood. So, we've got a generation now that we really didn't see years ago that are heavy and diabetic as children. It can be prevented.
And we also, see the development factor of just young boys and girls. And like you said, contributing to the food.
Yeah, all those hormones in the meat.
So let me ask you this. I want to get some clarity on this. Vitamin D, do you get that from dairy?
You can. Vitamin D is pretty much limited in a lot of the things that we eat. So primarily dairy, you get vitamin D from, but not a lot.
Now, why is it that some doctors may recommend that, right? And when we look at dairy, I hear there's a large percentage of actually how much pus is in dairy. And when you talk about that this milk that belongs to a cow is to help with nutrients of a 400-pound or however calf, why are we as humans okay with drinking that?
That's a good point. And I personally have thought about that. For those who wish to have that, they do have to recognize that there are a lot of things in cow's milk that really don't sit well sometimes with some humans. Lactose intolerance. And then, as you said, there are things in cow's milk that really are not for humans per se. So you've got other alternatives. You've got soy milk, almond milk, but the vitamin D level is not there in comparison to cow's milk.
Okay, so I'm sure somebody's watching, somebody's listening. And they're like, okay, we get it. You're talking about vitamin D. Dawn, you're talking about inspiring. Dr. Gaither, you're talking about vitamin D with pregnancy, but what if you don't know what your vitamin D levels are? How do you find them and what should they be?
Ask your doctor, check your levels, or you can go to this website, powerofb.org, get your own kit, check it. Your levels should be 40 to 80 nanograms per milliliter. That's best.
And the kit, is very simple. Fill out the questionnaire, complete the easy use kit, and then your results you can get online, the convenience, in 7 to 10 days.
Mm-hmm.
So tell me, what is the importance? Because I see in this kit, there's also a test with magnesium and omega-3. How does that play a factor?
Well, magnesium is a great nutrient. It's an important nutrient in your body. It's important for your muscle function. It's important for cardiovascular health. Omega-3s are, again, important for brain function. And particularly if you're pregnant, it's really helpful for fetal brain development.
Oh, wow.
Mm-hmm. You can get omega-3s in salmon. Yeah, it's a good source. But those three nutrients are pretty important for bodily function.
I had a chance to check out some other interviews, and you talked about, even looking at the decades of life, that there are certain nutrients that people need to add, or vitamins, depending on what age you are and decades you are in life. Can you talk about that a little bit?
Well, I would say if you're in your childbearing years and you're looking to get pregnant readily soon, some things that you should take, folic acid. Folic acid is really important in fetal brain development. And if you've been on oral contraceptives prior to trying to get pregnant, oral contraceptives can deplete certain vitamins and nutrients in your body. So if you're wanting to get pregnant and you're getting off of OCPs, it would be helpful for you to start taking a prenatal vitamin with folic acid prior to conception. Okay, so that's one thing that is really important. You should also be supplementing your iron, okay, because pregnancy is going to involve a lot of iron, with that placental function and getting your red blood cells together to, take into account the pregnancy effects. So I would say that if you're in your childbearing age, iron, folic acid are really pretty important. When you get into your 30s and 40s, I think you should really kind of think of looking at supplementing vitamin C. Okay, vitamin C is really good for your skin. And as you get further on in age, the skin begins to show signs of age, sags and lines and stuff. So you can take vitamin C not only topically, they're topical, but also oral. Okay, so I would consider that. Vitamin C is also important in immune function. So when the cold weather comes about, pop a vitamin C. Further on in age, as muscle function declines, you might want to start looking at mag supplements. Okay, and that's helpful for your muscle function and so forth and so on. CoQ10 is also important for muscle function, particularly if, you find that you're waking up with sore muscles and so forth. It's an antioxidant and it's good for muscle function. And of course, vitamin D. We don't have to talk about that. You always want to take your vitamin D. Yeah.
Oh, is that a vitamin D?
There you go.
So you talked about, interesting enough, time is changing. And it stood out to me that you said, hey, childbearing years. Times have changed. Have the childbearing window changed? Because we see women way down the line. I use that.
In their 70s.
70? Oh, carrying the baby.
Yeah, well, reproductive technologies have expanded Really, there are things that are being done that, certainly weren't done years ago. You've got uterine transplant. You've got all kinds of IVF procedures. You've got something that's known as pre-implantation genetics, so you can know what you're having, whether or not this child has any type of genetic issues when it's still an embryo. So, there are a lot of reproductive technologies that are going on, and women are waiting longer to have kids simply because they might want to, get their career off the ground. Mm-hmm. Or if they have particular things that preclude them from their fertility. So, it's a lot of stuff going on. I mean, it's no surprise at this point for me to have 50-year-olds in my, practice. I've had quite a few 50, 55-year-olds having their first kids.
Really?
Oh, yeah.
So does this interfere with the cognitive development of the child? Because I hear when you're up in age, oftentimes Down syndrome and other factors can come to play.
That is true, which is why it's important to have early prenatal care and genetic screening. And if you're going through IVF, there are things that can be done to assess the genetic complement of the embryo that's involved.
So if you have in your idea in the future to have a child, but maybe not tomorrow, should you just start taking prenatal vitamins in general, just like as an everyday supplement?
I would take a multivitamin.
Okay.
If you're interested in having a baby within the next 6 months, trying to get pregnant after it, then start taking your prenatal vitamins with folic acid.
With the folic acid. Okay, that's important because I know I was talking to a friend and they were just saying, just to stay up on these nutrients. And again, I want to thank you for coming on and talking about this because, like I said, vitamin D is about inspiring, but it's about being an instrument to your purpose. And just looking at the plethora of degrees that you have, Dr. Gaither, you didn't come to play.
I'm steady in school. I'm still in school.
I mean, you're at Cornell right now, right?
Yeah. Yeah, I'm getting my MSMBA.
What are you doing it for?
Well, here's the thing. Medicine has changed. So yes, I have the MD degree. So I know the clinical aspect of things. I have an MPH. So I can move around the public health aspect of things. So now with the MS MBA, I can have an active knowledge of the financial aspect of things. And it opens up a whole new world for me. I can be the CEO of something. I can open up my own company. I can, the sky's the limit. You wouldn't believe the things that have come my way, the offers that have come my way. So the world is really my oyster.
Oh, you better speak it.
From a whole different standpoint.
So I shouldn't say when it's said and done, because it's never done. It's a keep going process. What do you hope, or what's next? What do you hope to achieve with this? What do you want to see with Black maternal health care?
I want to see equity, reproductive equity. I want to ensure that every Black pregnant woman has a good outcome. Okay? I don't want it to be that they get some half-step in care. I want healthy mommy, healthy baby.
And that's what it's about. When you think about life And just like the vitamin D, right? Just the sun. It shines light, but not on its own vanity, but to give light to the plants, the very thing that gives food and fruit to us to live. And I guess I'm thanking you because that's the same thing of what you and I are both doing. Here, shedding light so that you can give life. For me, it may be in a motivational aspect of understanding how to love yourself and treat yourself with such so that you can branch on to have an opportunity to have a family. Have an opportunity to have doors opening because you decided to be dedicated and to educate yourself. But more importantly, have the opportunity to love yourself. Because I'm not sure we see that enough. And having you come on talking about vitamin D and the idea of when it comes down to Black maternal health, I can't tell you how much that means because without your kind of work, I would not be here.
Well, thank you.
And so what would you say are some of the ways, I know you listed some, and I was just looking up some information as some immediate ways, whether it be as individuals or maybe a collaborative effort in hospitals or in the healthcare realm that we can take steps forwards to improve, whether it be from our doctors, from our doulas, or whomever?
I think that the first step involves early prenatal care. I think it's important to think about what you're putting in your mouth. I think those are the two most important things. I think it's important to look at your family members and look at how are they eating? Because how your mother eats, how your grandmother eats, that's how you're taught to eat. So if you can look at those things and kind of make the connection between nutrition and health outcomes, I think that's a huge first step. That's huge.
And just to piggyback off of that, you mentioned it earlier, a sense of knowing who you are. And whether it's a sense of knowing what's in your family tree, it's kind of like that vitamin D light inside. And I speak about it consistently on my episodes about when you know who you are, you know whose you are. You know your power that you have. And while we look at all these disparities of people of color, it seems as though it's a stem of being stripped of your identity. Because if I don't know where I've come from, I don't know where I'm going. I don't know where I've been. I don't know where I go. I don't know the genetic makeup of me, so you can tell and do anything. But oh my gosh, when I walk in my authority, when I know the power of the D, look at the light that we shed. Thank you.
Well, now, if we want to talk about ancestry, everybody on this earth comes from a Black woman.
You want to talk today?
Everybody on this earth comes from a Black woman from Africa, whether or not they wish to acknowledge it, but it is what it is. It's fact.
And I hope that we can come together and consistently make it a collective approach, because we get so caught up in the whole divisiveness of life that we forget that we have to collaboratively work together. I mean, we see it even with the elements of the earth. Earth, wind, fire, water.
Yes. Yes.
So it shouldn't be treated as any different. Now, Dr. Gaither, thank you so much for joining us.
Thank you for having me, Ms. Donna.
How can someone find you?
You can find me on my website, KeciaGaither.com. And my name is spelled KeciaGaither. I'm on Twitter at Kecia Gaither MD. And certainly I'm at New York City Health Hospitals, Lincoln in the Bronx.
Wow. And also another thing I have for my guests, before they step out, I always ask them to leave a dose of vitamin D. Whether it's motivation, it's inspirational, food of thought, just something for somebody to chew on so that it can be a nutrient for their mind, body, and soul. What would you have to say?
You come from the first people that walk the earth. Recognize your power.
Well, thank you so much, Dr. Gaither.
Thank you so much for having me this time. This has been fun.
Here, we're talking about the power of D and vitamin D. And I want to thank Dr. Kecia Gaither for coming on the show because, we talked about pandemic pregnancy. We talked about what's working and what's not working, but more importantly, how to work ourselves. And that's becoming educated. That's what's knowing what's going on. That's taking the steps to making sure that you take the nutrients so that you can start your family, so you can cognitively work in your best self. Because why? You are your greatest asset. And this episode was all about you depositing into you. You hear me? You know it feels good to feel good, right? So it's time to love on yourself and take your health to the precedence of your life. Because what they say, the most precious things are your health and time. One without the other, you cannot exist. So what do you want? Just something to think about. So thank goodness for people like Dr. Kecia Gaither who are putting this on the forefront so that you can think about what the life you want and how you're living your life. It's some mode of self-reflection. Okay, so now it's that time of the show where I want to give you a dose of vitamin D, okay? So, without further ado, this is a quick dose. So today's dose of vitamin D is dedicated to being magical. Would you believe me if I told you that you were magical? Because guess what? You are. Did you know that you can attract anything you want out of life? Guess what? You can. Sometimes I think that we forget the power that we possess, how we have the ability to attract whatever we want out of life. And just like in Ariana Grande's hit song, Just Like Magic, she belts, I get everything I want because I attract it. And so can you. I mean, think about it. It takes electric currents. You got your positive, you got your negative, that can either retract or attract or repel in a magnetic field. So it's that same electric currents that are in our body and in our brain, and it makes it possible for us to move, for us to think, AKA magic. So what are you calling forth in your life? Ariana sings that good karma is my aesthetic. Keep my conscience clean. That's why I'm so magnetic. Have you actively thought about what you are attracting? They say what you think is what you become. So who are you, or better yet, who are you becoming? Are you who you want to be? Take note from Ariana Grande and know that you are just like magic and that you can have anything you want out of life because you can attract it. Well, that's it for your dose of vitamin D. I want to make sure you follow me on all social media at Dawn Dai Speaks. And I want to thank all of you for tuning in. Thank you for being part of my dreams. This is only the beginning. And I want to thank somebody special, Jeremiah. I wouldn't have been able to do this without you. Thank you for stepping up and showing out. And this is just the beginning. And for you watching, I can't wait for the next one. So until next time, always remember, you are your greatest asset.